All right, so adherence to medication, right? Is can there be need to be familiar with the names of the section and the content. So this chapter is going to talk about what are different types of adherence, right? This is also going to talk about why or what, why do people adhere, right? What thought process do people go through when they adhere, right? So are they logical? Are they emotional? What they're gonna look at? What they're not gonna focus on? So why do people adhere and types of adherence? Then we're gonna talk about how to find out whether people actually adhere or not. So is there any way to measure adherence? That's gonna be in the second portion. The third portion will talk about how to improve people's adherence, right? Is also gonna talk about क्या कहते हैं, basically, like how to get people to be more adhere, like is there any method to make people go through that. So first of all, we're going to talk about adherence. So regarding adherence, right, basically it's whether you follow the what the doctor told you. Yes, तो adherence के अंदर आएगा, if no तो non adherence के अंदर आएगा. So do you follow what doctor told you? Normally people think that, what, adherence only consists of treatment, whether you're taking the medications or not. But that's only one form of adherence. There are different types of adherence as well, right? So this is what you're gonna talk about, right? So there's, because there are different type of adherence, there are also different type of non-adherence. So Clark says that, what, not coming to an interview जब डॉक्टर ने बोला होगा, that's also counts as a non-adherence. If you come to the interview, वो adherence के अंदर आएगा. If you don't come to an interview, वो non-adherence के अंदर आएगा. It's not about क्या कहते हैं, treatments के अलावा भी दूसरे life के अंदर life aspects के अंदर भी adherence देखा जाता है. For example, a doctor may ask you to take a medicine, but he may ask you to what, change certain habits of yours. For example, you are gonna take heart medications, right? Okay, you are heart patient. Heart patient, but he may ask you to give up smoking. So if you're taking the medication, but if you're not giving up smoking, as in you're not changing anything of a lifestyle, then you are also not adhering. Uh, for example, the doctor tells you to, what, you're not supposed to walk around Zada. So he's also telling you to avoid something. So if you don't engage in preventive measures, that also counts as non-adherence as well. It's not related to only the dawaiyan. Uh, Also, not following a doctor's advice, well, yes, dawaiyan ke andar aayega, short-term advice, but not following that is obviously not adherence. So basically, first of all, you need to remember what Clark said. How many types of non-adherence there are? There are four: short-term advice, interviews, lifestyle changes, and preventive measures. So this is gonna be the first portion that you need to memorize. कि क्लार्क ने type of non-adherence कौन सा बोला है. So क्योंकि इस section का नाम है types of non-adherence and why people don't adhere. So we are done with the types of non-adherence for now, and then we're going to look at the reasons why people do not adhere. So this is a CIE question के by types of non-adherence बताओ. So this is exactly what Clark said. You need to remember these four and give one line simple definition. That's what all CIE people expect from you about this section. There's nothing else. ठीक है ना. This slide जो slide number 4 है, and this slide जो slide number 7 है, right? ये तुम्हारे syllabus का हिस्सा नहीं है. These are not part of your syllabus, but these are there for your basic understanding, right? So you may look through them as well, but this is not the best part of the course syllabus. The course syllabus is gonna be on Clark. So Clark's type of non-adherence, right? Is it holistic? Yes, it looks at different factors for four aspects for sure. Number two, is it applicable? Yes. As a doctor, we can use this as a checklist to make sure whether the person is adhering or not. हम इससे कोई ना कोई criteria of adherence form कर सकते हैं. So it's very holistic. Sorry, it's very applicable. Is it individual situational? Well, this may come down to different individuals. So different individuals will do different things, and different individuals will not do different things. So whether the people adhere or not adhere, it is also individual. Also, sometimes हो सकता है कि it might be situational as well. Situational factors कहाँ से पता चलेंगे? यहाँ से पता चलेंगे. For example, हो सकता है कि जो दवाइयाँ आपने दी हैं, right, उसके इतने side effects आते हैं. कि the people don't like taking medication, so they will not take medications. अगर आप दवाएं change कर दो या सस्ती कर दो, then they might adhere. So sometimes it is the treatment that is the problem. So that's going to be situational, right? कभी कभार, for example, कुछ लोग होते हैं जो बहुत दूर रहते हैं हॉस्पिटल से, तो obviously बार बार चक्कर नहीं लगाएंगे. They're not going to come for a follow up. So sometimes कुछ factors situational हैं, लेकिन कुछ ज़्यादा factors individual होते हैं. As in, it could be the fault of the patient, it can be the fault of the doctor as well. As in, you know what, the doctor didn't give you enough time, the doctor wasn't good to you, right? So you know what, the next time your doctor tells you something, you won't do it because the doctor wasn't nice. And doctor is a individual, so ये भी individual perspective में भी count होगा. Is there any culture biases? Well, overall conceptually nahi, but different cultures may have different types of non-adherence ज़्यादा as compared to some cultures, right? For example, uh, देसी the पाकिस्तान वगैरह, you know what, देसी टोटके ज़्यादा इस्तेमाल करते हैं, right? So even though they may take medication, लेकिन उसके अलावा साइड पे देसी टोटके करते हैं, right? That may count as a non-adherence के भाई, why you're doing some extra thing that the doctor did not tell you. कुछ मुल्क में ऐसा नहीं करेंगे, right? uh, in some cultures, right, they might ज़्यादातर give importance to spiritual healing aspect, not the doctors को ज़्यादा. So they will not, yeah, may not give ज़्यादा importance to a doctor, and they may give importance to the religious activities, right? For even though क्या कहते हैं, they go to a doctor. So different types of non-adherence किसी culture में जैसे ज़्यादा होगा, ये different reasons for non-adherence किसी culture के अंदर ज़्यादा होगा. So overall universally applicable, लेकिन इसका रेशियो शायद कल्चर के मुताबिक ऊपर नीचे हो सकता है. Now we're going to talk about why people don't adhere, as in why don't people follow the doctor's advice. What's going on with them? So there is one aspect, ठीक है ना, that people are rational. By the way, this is we're still in the first section. Again, first section का second where concept or theory of research, right? This is the second research in the first section of health, second chapter. So, are people logical? Do people make logical decisions when they don't want to follow a doctor's advice? If yes, let's look at how. So, to prove this concept that people are very logical, right, when they don't follow doctor's advice, and to prove this concept, we have two experiments in our syllabus. So rational non-adherence is based on rational choice theory. Basically, you are given क्या कहते हैं choices, and you're gonna evaluate किस choice से ज़्यादा फायदा है और किस choice से कम नुकसान है at the long term, short term cost and benefits. If something is costing you more, you will not do it. If something is overall benefiting you more, you will do it, right? So people will do things more that benefits them ज़्यादा and costs them less. So if a treatment is not beneficial for the itna zyada but cost them a lot of things, so they will not adhere. So yeah, for example, जो खतरनाक ट्रीटमेंट होते हैं, फॉर एग्जांपल यहाँ पे चांसेस ऑफ फेलियर ज़्यादा हैं या साइड इफेक्ट्स इस दवाई के ज़्यादा हैं, so people may perceive them to have ज़्यादा costs, less benefits, and people may not adhere. लेकिन the experiment, so the experiment that you have first of all is by Lava, Bryan and Jan, Australian study, may not be generalizable, right? Because people are only representative of Australia. दूसरे ममालिक के लोग दूसरे तरीके से सोचते होंगे भारत. So basically, Lava, Brian, and Jan, basically they gave a questionnaire to different Australians. It's not an experiment, basically, it's just a survey conduct किया गया था. And they wanted to find out कि भाई, when you follow a doctor's advice or when you don't follow a doctor's advice, right? आप किस चीज को कंसिडरेशन के अंदर डालते हैं और किस चीज को कंसिडरेशन के नहीं डालते. So there were 1, 2, 3, 4, 5, 6, 7 factors listed, and people were supposed to say that this is what I take into consideration, and this is what I don't take into consideration. So when asked why don't you follow doctor's advice, they were asked कि भाई क्या कुछ treatments तुम्हें alcohol consume करने से रोकेंगे, right? So is that a factor you will think about when you don't want to follow doctor's advice? The Australian people said no. You know what? Alcohol se mein roke, that doesn't really matter to us. So alcohol rokening वैसे we will not जानबूझ के go against a doctor. Alcohol लोग दे उसके बावजूद we will still follow what the doctor said. Uh, then they would ask you, you know what, कुछ होता है ना कि severe symptoms आ गए और कुछ होता है कि मामूली symptoms आ गए. For example, you have COVID, that is severe, and let's suppose you have a common flu. So does the severity on your condition depends whether you follow doctor's advice or not? People of Australia said, you know what, doesn't matter. Agar mamuli bhi symptoms honge, we're still gonna follow doctor's advice. Nahi bhi honge, we're still gonna follow doctor's advice, or we're still not gonna follow doctor. We don't take that in consideration. Doesn't matter. But they were asking, bhai, the treatment itself, for example, the type of treatment, the nature of treatment, right? The side effects of treatment, how many medicines you're going to take, all the aspect of the treatments. Do you take that into consideration when you don't want to follow doctor's advice? The Australian people said yes. That does matter. The Australian people also said yes to long-term medication harm. If it has long-term medication harm, we won't follow doctor's advice. The Australians also said that, you know what, we also consider long-term benefits as well. So we're going to consider the treatment itself, how much the treatment is costing, the long-term benefit, the long-term harm, and the short-term benefit and harm as well. So basically, Australians care about these things when they want to follow or don't follow a treatment. They don't care about this, right? So basically, people do consider long-term benefit and short-term benefit and harm as well. So basically, whatever the decisions Australians are making, whether to follow a doctor, not to follow a doctor, is not basically they're emotional or they're lazy. अगर होता तो ये वाली चीज आती. Is basically they're logical in their own manner. ठीक है, क्योंकि ये वाले factors आ रहे हैं. So this does prove कि, you know what, non-adherence के अंदर कोई ना कोई logical thought process चलता होगा, that people do consider long-term pros and long-term cons. ठीक है. So again, people were I have a question. What is that? Cost, yeah, क्योंकि Australians के लिए cost आ रहा था ना, the cost being, you know, देखा. So people were likely to not adhere if the health outcome were, for example, framed in sort of क्या कहते हैं, side effects. Yes, अगर आपके treatment इस तरह दिखाया जा रहा है कि it's gonna have more side effects, so people are not gonna take it in Australia. Side effect या नुकसानात, as in it's gonna cost more. Yeah, it's gonna be hectic. Yeah, so many medicines involved. So many side effects involved. A percentage of you getting better is very, very less. So people will not take that treatment. Okay. So basically, it's essential how you promote your treatment. It's gonna have an impact on how people are here or not. Is it applicable? Yes. Advertising agencies के लिए or doctors के लिए, it's very, very essential how you talk about your treatment. बुरी चीजें कम बोलो, अच्छी चीजें ज़्यादा बोलो. Is it generalizable only to Australians? So culture bias भी आ सकता है, different countries के ना different reasons भी आ सकते हैं. Is this replicable? Yes, we can take their survey and we can apply it in our own country. So it is going to be replicable. Is it valid? As in, well, can we consider these answers or findings to be legitimate or questionable? Well, these were online questionnaires. Number one, people solved them on their own. So people may lie on this questionnaire. हो सकता है कि they might consider alcohol, but you know that उनको पता है कि कोई और बंदा हमारा responses पढ़ेगा, examiner, sorry, researcher, तो हो सकता है you know what, they might lie to demand characteristics आ सकता है. कहाँ गया ये? Is it holistic? Talked about many factors, right? Long-term, short-term benefit, harm, and cost and treatments. Individual situational is both. किसी individual के पास ज़्यादा पैसा होगा, he might not take cost into consideration. किसी के पास कम पैसा होगा, he might take into cost into consideration. Situational as well. For example, the regimen, treatment itself. For example, treatment कितना hectic है, कौन से side effect हो रहे हैं. The side effect may come in some people, may not come in some people. So this is a individual as well. उसके अलावा अगेन सिचुएशनल एस्पेक्ट भी आ सकते हैं. फॉर एग्जांपल किसी के लिए दूर पड़ रहा होगा, किसी के लिए कम पड़ रहा होगा. सो फॉर एग्जांपल किसी के दूर पड़ रहा होगा, उसके लिए कॉस्ट ज़्यादा रहा होगा. सो सिचुएशनल एज वेल. कल्चर बाइस एज आई सेड कि ये ऑस्ट्रेलियन कल्चर के हिसाब से ये चीज़ें हैं, दूसरे कल्चर के हिसाब से क्या पता कोई और चीज़ें हैं. Overall, this does show that, you know, people are logical when they want to take or not take medication. Now that's study number one. Next proof you have is by Bulpit. So, Bullpit also wants to find out कि क्या people look at costs and benefit when they don't wanna follow a treatment or when they do wanna follow treatment, right? So his sample is done on senior citizens or senior patients who are given antihypertensive medication. So these people have hypertension, and these are elder people. Questionable generalizability यहाँ पे भी क्योंकि you know what, these are elder people, not young people, may not be applicable on them. And यहाँ पे again health psychology के अंदर please remember there's always going to be a problem with generalizability in terms of the medical condition they have. यहाँ पे medical condition is obviously hypertension. So is it applicable to patient of different क्या कहते हैं medical conditions? We don't know. So यहाँ पे generalizability का मसला है on two bases: the age range and the medical condition that the people have. All right. So basically, what Bullpit does is people are going to some hypertension treatment, right? And hypertension treatment जो है वो दो इलाके से दे रहे हैं. एक इलाके के अंदर ये हॉस्पिटल्स है, दूसरे इलाके के अंदर ये हॉस्पिटल्स है, right? And both of them give hypertension treatments. So the ये दो है, right? They are gonna give hypertension treatment, but they're also gonna tell you that you know what the drug that you take for hypertension इससे तुम्हारे पास gout भी हो सकता है. You're gonna have diabetes as well, diarrhea as well, dry mouth as well, and chest pain. Yeah, it's gonna solve your hypertension, but you know what? You're gonna have these problems happen to you. Now, if you are a hypertension patient, you know what? You want your hypertension involved, but you know, look at how many additional things you may be getting. So you might figure, you know what? Just live with hypertension. I don't want these additional problems. But now look at this hospital or this group. ये लोग भी hypertension की treatment देते हैं, but they say कि you know what? जो medications हम देंगे is gonna reduce your heart attack chances and stroke by 40 and 44%. So over here, यहाँ पे they're gonna talk about additional problems you will have. यहाँ पे they're gonna talk about तुम्हारा hypertension में हम कौन कौन से मसले solve करेंगे. मतलब these will show but not necessarily as a 100% नहीं आता क्योंकि यहाँ पे ratio लिखा हुआ, but these are possible, you know. So I'm gonna ask you this. You know what? Let's suppose you're hypertension. Which one will you take? The first one or the second one? Second, right? And people did actually prefer the second one. The reason is जो दूसरा वाला है, it tells you कि तुम्हें hypertension के हम ये hypertension के ये मसले solve करेंगे. Hypertension related ये मसले जो हम solve करेंगे, right? That's the second treatment वाले लोग people say. All right, no problem, Iman, no problem. कहाँ से समझ में नहीं आ रहा? For example, can you tell me the exact point जहाँ से समझ में नहीं आया? The question you asked. अच्छा, you do understand the two treatments, right? The two groups. एक तो treatment को इस तरह दिखाना है, दूसरे को इस तरह दिखाना है. इतना समझ में आ गया? ठीक है. So I asked you कि भाई तुम कौन सा लोगी, पहला वाला दूसरा वाला? The first or the second? The second, right? अभी तक यही पूछा. So don't worry, you're still on track. Now, I was gonna say that the people in the experiment did choose the second as well. The reason is, you know what? If you are a hypertension patient, and the second one is saying, okay, you have these certain issues that are hypertension originated, हमारा मेडिकेशन विल सॉल्व दीज हाइपरटेंशन इश्यूज, ये ना कि हाइपरटेंशन के ये मसले हैं और हम ये मसले सॉल्व करेंगे हाइपरटेंशन से रिलेटेड, नथिंग स्पेशल। पहला वाला क्या है कि भाई आपको हाइपरटेंशन तो ट्रीट हो जाएगा, लेकिन आपके नॉन हाइपरटेंशन रिलेटेड मसले आ जाएंगे, एज इन ड्राई माउथ, डायरिया, डायबिटीज इज नॉट हाइपरटेंशन रिलेटेड, ये कोई और डायमेंशन में जा रहा है। सो आपका हाइपरटेंशन तो सॉल्व हो जाएगा, लेकिन दूसरे मसले आ जाएंगे। सही है। यहाँ पे क्या होगा कि आपका हाइपरटेंशन रिलेटेड मसले सॉल्व हो जाएंगे। सो बेसिकली व्हाट देयर सेइंग इज कि अगर आपको साइड इफेक्ट मालूम होते हैं, and those side effects especially are of very unrelated nature. For example, तुम जा रही हो to solve your toothache, right? तुम्हें बता रहे हैं कि भाई toothache के जो ट्रीटमेंट है उससे तुम्हारा वेट बढ़ जाएगा ना, toothache and weight has no connection। तुम कहोगे यार मैं दांत सही करवाने, अब मैं अलग चीज के बारे में सोचूं, तो बेसिकली इफ यू हैव एनी साइड इफेक्ट ऑन अ डिफरेंट हेल्थ एस्पेक्ट, यू आर नॉट गोना टेक दैट ट्रीटमेंट। सही है। तुम्हें तो साइड इफेक्ट तो आते हैं, लेकिन वो भी दूसरे एस्पेक्ट ऑफ लाइफ में पड़ेंगे। नाउ यू हैव टू वरी अबाउट टू थिंग्स, बीइंग ओवरवेट एंड toothache, right? So it's gonna add additional burden on your life. So basically what they said is they should promote treatments to focusing on more benefits, and they should not focus on highlighting additional problems. So if you highlight more additional problems that are not related to what people are having right now, people are not going to take your treatment. And if you highlight additional benefits to your treatment that you're obviously offering, उसके ज़्यादा additional benefit दोगे कि भाई ये भी सही कर देगा, तो people are gonna take it. That's the conclusion. So basically, if people like you people chose the second one, these people chose the second one. So basically, people did not adhere to this treatment. People adhered to this treatment. So obviously, the reason why people did not adhere यहाँ पे is because people are logical about it. They follow this rational choice theory. So yeah, so these two experiments proves that people are rational about their non-adherence at points at times. So Bullpit study, is it holistic? Well, talk about psychological fact. Psychological is the क्या कहते हैं rational adherence theory, okay, how people make decisions, and physiological aspect is basically the health portion. So basically, how people make decision is the psychological aspect, and the physiological aspect is what treatment, what side effect people are going to experience. So basically, it's a holistic study. In my view, तुम कह सकते नहीं है holistic, you know what? ठीक है, मसला नहीं है. Is it applicable? Yes, क्योंकि it will tell the doctors how to treat, how to formulate the treatments, what to say, what not to say. Is it individual situations? Purely situational, क्योंकि ये situation और ये situation में वाकई फर्क है. So you prefer this one क्योंकि यहाँ पे situation लगती, not because of your individual personalities. Is it culture bias? Well, हो सकता है कि different cultures के अंदर different decision making patterns होंगे. For example, what I'm supposed to say is that logically you will prefer this, right? लेकिन some culture वहाँ पे हो सकता है कि यू मेक डिसीजंस ऑन इमोशनल बेसिस या जान पहचान के बेसिस. सो फॉर एग्जांपल, ये जो पहला वाला जो सीन है ना, ये लेट्स सपोज जान पहचान वाला डॉक्टर है, मोहल्ले का है या आई डोंट नो, लाइक जो भी मोहल्ले का है, खानदान का है. दूसरा वाला इज कंप्लीटली न्यू, यू डोंट नो हिम, ही इज अ स्ट्रेंजर. So होता है कि sometimes because of certain cultures you might prefer this one even though it's more harmful, but क्योंकि जानने वाला you still go with it. So different cultures के अंदर different decision making systems होते हैं which might impact how you express non-adherence. Was this study generalizable? No, as I said, hypertension people and elderly population. So up till now, हमने Clark key type of non-adherence किए, and to find out whether people make decisions rationally, we did two experiments by Bullpit and the Australian study. अभी तक कोई मसला? Iman, has your question been cleared? What does it mean to be holistic? ठीक है Sharyar. Holistic is basically, are you looking at things from multiple angles? Basically, if I say okay, you are depressed because तुम्हारे genes में depression है, I don't look at how your situation is, I don't look at how your house is, I don't look at how your family is, I don't look at what you had to go through. I just say genes, is the cause of depression, nothing else. So basically, I'm sidelining every other possible explanation, or I'm sidelining many aspects. I'm looking at one singular aspect, right? So if you feel that this study is looking at one singular aspect and missing out multiple things, it is a reduction. But if you feel that this study is looking at things from more than many possible angles, yeah, many factors were considered, so then it's going to be holistic. ठीक है. All right. अच्छा ये क्या है? So design a study using a questionnaire to find out क्या कहते हैं, characteristic of people who attend or don't attend medical appointments. सही है. ये सीन है भाई. तो बेसिकली जो अटेंड करते हैं और जो अटेंड नहीं करते, उनके क्या कैरेक्टरिस्टिक्स हैं, क्या फ़र्क है दोनों में या नहीं. सो ऑब्वियसली दिस इज ए क्या क्या कहते हैं, दिस इज अ चॉइस. ठीक है. तुम्हें लग रहा होगा कि दिस इज ए कंपेयर क्वेश्चन, यू आर गोना फाइंड आउट कि भाई उनका क्या कैरेक्टरिस्टिक्स है, उनका क्या कैरेक्टरिस्टिक्स, राइट. If it was a comparative question, यहाँ पे बीच में and लिखा होता, people who attend and fail to attend. But यहाँ पे और है, so they give an option to भाई you can find out the characteristics of people who don't adhere, or you can find out the characteristics of people who do adhere. यहाँ पे you don't need to find out the characteristics of both, right? You're going to study only one type of people. So this is not a comparison question. This is a discovery question. You're going to find out, go and discover उसके क्या characteristics हैं. You're not going to compare उसमें और उसमें क्या फर्क है. Not going to do that, right? So this is a question that you might want to solve, right? What type of questions you're going to ask? Yes, that's the thing. So characteristics, right? So अभी तक जो चीज़ हमने पढ़ी, we're going to use that. We're going to ask it, भाई, do you look at the cost of treatments? Do you more particularly prefer long-term benefits or short-term benefits? Do you in particular prefer, or do you particularly look at long-term side effects or short-term side effects, right? How क्या कहते हैं, does emotions play a role in your decision making whether you wanna क्या कहते हैं attend appointments or not? What are additional factors that make you want to attend medical appointments or not, right? So these are the questions that you can ask. Long term short term से पता चलेगा कि भाई ये long term oriented है, short term oriented है. Cost से पता चलेगा कि this person also looks at financial aspect. Emotional वाला question इसलिए पूछे to find out whether he's rational या नहीं. And other open, एक आखिरी में open ended question मैं छोड़ा कि what other factors make you want to attend or not attend? Yeah, I see, to find out more factors, right? अच्छा, अभी हम ये क्वेश्चन अभी नहीं छेड़ेंगे. Failure to attend medical appointment should be punished debates. अभी हम नहीं छेड़ेंगे. We're gonna move on to the
Sir?
Yeah.
So to design the study, can we do the question right now? Because I'm facing a problem doing a designer study. Sir, I can't do the designer study question at school, so that's why I wanted if you can help us right now.
All right, so we can do this question right now. ठीक है ना, मुझे मसला नहीं है. All right, so I'm up for it, right? So yeah, you can do this question right now. Guys, you can do this question right now. So करना कि you don't have to do this entirely. एक काम करना, देखो पूरा नहीं लिखो. What you do is like ये ना, let's start with IV क्या है, DV क्या है. Well, make a list. IV क्या है, DV क्या है, setting क्या होगा, design क्या होगा, right? और क्या था यार, हाँ, methodology as in how we collect data. Methodology, right? What type of data you're gonna get, data analysis किस तरह करेंगे, sampling technique बता दें, analytics, consideration क्या होंगी, and controls. But इस तरह लिख के दे देना. We're gonna talk about screen is blank. एक मिनट. अब आया?
No, sir, I can see the screen.
You can or cannot?
It's not blank.
Black हो गया.
I can.
अच्छा. Yeah. So like Sharia, I need you to do this as well, right? They go for this experiment. You don't need to know health psychology in general. So basically, you need to just need to know the basics. So it's like what? 10 minutes should be okay. I guess 12 minute maximum to come up with these points. Then we're gonna continue. You guys do this question. I'll be BRB 2 minutes.
Sir, can you open the questions?
All right, guys, I'm gonna restart this meeting क्योंकि time आप होने वाला है. So yeah, Zoom's time is gonna be up. मैं restart कर रहा हूँ.